Hello, everyone. You probably all heard that I got a positive COVID test. And so now I'm getting some professional advice that hope is useful not just to me, but to anyone who might find themselves in the situation. Dr. Dara Kass, welcome, Dara.
Hi, Andrew. How you feeling?
I feel all right. I feel like I've got a mild flu. Yeah, not so bad.
When I had it, talking as a doctor and a patient, right? I was surprised at how crummy I felt, actually, because a lot of people had said it wasn't so bad, but I felt pretty terrible, like fatigue, muscle aches, headache, a little nauseousness, and I really just needed to drink a lot of water and take some naps.
How long did that last for you?
So I started having symptoms on a Monday and I really got better somewhere around a week later. But I remember that the first couple of days I had it, I didn't even know what it was. I just thought I was run down from running around. And I imagine that running a mayor's race, probably the same thing might have happened to you, where you maybe didn't see what was happening. You thought things were a little off, but you weren't entirely sure what it was.
Yeah, that's exactly right. I woke up on Saturday feeling a tiny bit run down. But then that unfortunately is not an unfamiliar feeling sometimes. When you're in the midst of a campaign, and so I took a test that day, and when it came up negative, I thought, okay, like this is just me being, like a little bit over zoomed or worked or something. I just felt like a tiny bit drained, but not so much so that like it set off alarm bells.
Yeah, we find a lot of patients who have this. When we ask them when your first symptom was, we say, when did you really start feeling tired or fatigued or have a headache? It winds up being the couple of days before they took it seriously enough to get a test. And that's one of the hardest parts about containing this is when people start to feel tired or fatigued, getting them to separate away from their family so they stop spreading it, even before a test is positive. And so what I say to people is pick a bedroom for the person that isn't feeling well and give it to them, even if it means that a bunch of people are sleeping. And sometimes it does mean that the dad gets the kids' bedroom, which looks like that's
You
where
can
you
see
are.
it here, so I'm in the kids' room. I got the bunk bed going.
Right. And so if you can, the things I say are things like stop eating as a family, right? So deliver food to the person who
Done.
has it. Right. So, because once you find out you're positive, you've gained back a couple of days of isolation. And so now, and then if you don't feel well after a couple of days, retest yourself. And that's the thing about the rapid tests is they're really good at finding people who are infectious and symptomatic, which is what happened to you, right?
Yeah. So yeah, I'm definitely going to be spending a lot of time in this room, quite by myself. So what comes next for me, Dara? Like I'm imagining a lot of rest, a lot of liquids.
Yeah. So most important thing is to drink a lot of fluids. You can take Tylenol and Motrin to, keep your, fever down or your muscle aches and fatigue. It's really important that you rest. And I know that's not going to be so easy for you, but you really should, if you want a nap, take a nap. God willing, you should be able to say after a week or two, hopefully you'll be on the other side of this. But pay attention to your body. It's really important that you are not overly optimistic about it being over, but really give your body a chance and pay attention to your symptoms. Things like shortness of breath and cough, make sure that you pay attention to them. I recommend people get a pulse ox, which is a thing you put on your finger just to give you some data to tell you what your oxygen is.
I do like data.
I know
Another thing I heard is that like lying on your stomach is helpful. Is that a thing?
So it's a thing. It's called proning, and we do it in the hospital for patients that are low on oxygen. It's not really necessary for people that aren't having problems with their oxygen, but if you feel like a little tummy time would make you feel better, then you should go for it.
Okay, proning to be tried. Who doesn't like some tummy time?
Exactly. But you're in your room for 10 days. You understand that?
Yeah.
10 days from the day you had symptoms. So from Saturday until 10 days, that's when you're allowed to go. And your family is now in quarantine, right?
Yep.
For how long?
The same period?
10 days. And this is how we stop the spread for other people, right? Is to make sure that we keep those who are exposed from going and exposing other people while they're waiting to find out if they have it. This proves it, man, this virus is everywhere. mask wearing, being diligent will help us stop the spread, but it's not going to be perfect until we get everyone vaccinated and until we really stop the community spread.
Yeah, let's get the vaccines out to people. I will confess that I'm looking forward to having antibodies, which I'm sure you were too when you had it.
I was. Every day I woke up, I was thankful that I could breathe, and I knew it was one day closer to it being over.
Yeah, that's the way I feel too. It's like I can breathe and time is passing, so things are pretty good.
It's one day at a time, and if you can get through the 10, then you feel blessed,
I think my big lesson from this would be really, like, I did not feel that unwell early on, I didn't have that feeling that I thought I would have.
That's what I want people to hear from you, I think, is that it's not a big flashing sign that says, hey, you have COVID, go sit in your house. It's a very subtle onset. That's how it keeps spreading. It's because those couple of days are just, you think you're tired or you have a headache and you don't realize until a few days later. And those were probably the times that you may or may not you, but anybody may or may not have run the risk of spreading it to anyone else. It's hard, but the most important thing is to make sure that you're doing the best practices every day, even after you recover, so that you're an example for other people like you've been. Because that's why people like me who've been antibody laden and, post-COVID for almost a year still wear a mask to encourage.
Plus, you're vaccinated and because you're a healthcare worker, an essential. And of course, it's like it would make sense to wear a mask because, it's just helpful.
It's just helpful. And it's a good example, especially for our kids.
So, Dara, what resources would you recommend to someone if they either think that they may have COVID and need to get tested, or if they test positive like I have?
So if you think you were exposed or you're starting to get symptomatic, the most important thing to do is to get tested. If you're symptomatic, getting a rapid test is a great idea because it tells you what to do right away. If you're exposed and you're going to isolate anyway, then getting a PCR and knowing the results may take a day or two is fine. But you want to make sure that you act as if you have COVID if you've been exposed or symptomatic, just to make sure you don't spread it to anyone else. If you are positive and you live somewhere that you can't isolate from other people, there are city resources. Not only the package that you get, which you'll get, it's a love package from the city that gives you hand sanitizer and gloves. Did you get it yet?
I've not gotten my love package, but I'm looking forward to it now.
The city sends through contact tracing, they'll send you a package of sanitizer and masks and all kinds of equipment to keep your family safe. But they also provide housing if you can't stay with your family and you can't isolate within your own house. And so we want more people to take the city up on that. And then, of course, you want to make sure that you tell your employer, you tell your friends, you tell your contacts. There is nothing to be embarrassed about. One of the best ways for this virus to spread is for people to keep their, positive diagnosis and their infection to themselves and not let other people know and not act responsibly. So please, I am imploring everybody to ask for help, use the resources, and stay home. Get tested as frequently as you need to and act accordingly with the results. And the last thing I will say always is please don't. You can text COVID test to 85548, and that will give you locations for testing. And you can city testing. There's health and hospital centers everywhere. Urgent care centers will do testing. We are very fortunate in New York City that if you need a test, you actually can get a test right now. And the results are coming back still in a reasonable amount of time. So until we get a critical mass of New Yorkers vaccinated and we still see the spread of this virus over and over again, we need to make sure people are empowered with the ways to stop the infections, which means testing frequently, acting accordingly, and keeping our families safe.
All right. Well, fantastic. Thank you, Dara. I'm on the road to recovery. I feel better informed thanks to you. Now to give myself some tummy time. I'm just kidding. Talk to you soon.
Bye.